Hello and welcome to our COVID-19 update where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello Minister, thank you for joining us today.
Well, thank you very much for having me on the program.
So Minister, let's start with an update on the number of persons vaccinated.
So as of yesterday, we have had 229,846 persons receiving their first dose. This would be approximately 47.2% of our adult population. And we've had now 103,029 persons who have received their second dose, which would be approximately 21.2% of our adult population. Over the last couple of days, we have seen more people coming in for second dose, and we have seen less people coming for first dose. So that's something that we have to encourage more people to come and get their first dose, because we have first dose that is available to everyone.
Okay, Minister, I know you mentioned that we have about 103,000 persons that have taken the second dose, and earlier this week you had mentioned that you were hoping to reach that 100,000 milestone. What does this mean in terms of going forward to achieve herd immunity?
Well, this is pretty good because by people having both doses, we are getting closer to herd immunity. We estimate that we'll have to get at least 80% of our adult population vaccinated with both doses. So this is a step in the right direction. We are now at approximately 21%. We still have a far way to go, but I think if we work with people and get them to come and get both doses, then Guyana would be much better off.
Okay. Can you say what may be the issue why persons aren't coming forward for first doses lately?
Well, that's what we're trying to figure out, because in almost all the regions, we have seen a relative decline in first dose vaccination. And initially we thought perhaps because of the flood people were not coming forward. But in some of those areas, the flooding has eased up, and we're not seeing people coming out. So we will do some assessment. We have been talking to the RHOs in those regions. They have been reporting that people are a little bit more hesitant. And so we'll have to see what is driving that hesitancy and then work on maybe demystifying some of the things that people have in their minds. So we'll have to continue working on that.
In terms of Region 10, because we know that that's been the region that has been lagging the most, have we seen any improvements since the last time?
Region 10 has had marginal improvement. So at one point we were talking about the percentage of people who took the first dose was about 11.5%, maybe about a month ago. So as of today, they're 14.3% for first dose and 5.8% for second dose. So there's been very marginal, I would say, a marginal increase, and that's basically what it is.
Okay, Minister, before we move off of the vaccination numbers, can we have a regional breakdown?
For region, well, with first dose, Region 1 is at 58.6%, Region 2 at 43.3%, Region 3 at 46.7%, Region 4 at 48.7%, Region 5 at 49.9%, Region 6 at 55.1%, Region 7 at 46.2%, Region 8 at 31.7%, Region 9 at 45.7%, and Region 10 at 14.3%. When we look at the same regions for second dose vaccination, we have Region 1 now at 20.9%, Region 2 at 21.7%, Region 3 at 19.8%, Region 4 at 24%, Region 5 at 21.1%, 22.1%, Region 6 at 22.2%, Region 7 at 16.8%, Region 8 at 11.4%, Region 9 at 16.6%, and Region 10 at 5.8%. So with second dose, we are at 21.2% overall, but you can see the disparity in the different regions. So there's a lot more work to be done in regions 10, 9, 8, 7, and to some extent region 3 as well.
Okay, thank you for that, Minister. Now, I know Guyana is expected to receive shipments of vaccines from COVAX and through the arrangement with CARICOM and the African Union. Can you please provide an update on this? Because I know you had mentioned this was supposed to be arriving in country this month.
So with COVAX, we were expecting those vaccines by the mid of June. Unfortunately, COVAX has written to us to say that there is a delay in that shipment, and now they're scheduled to send those shipments in July. So we await from COVAX the specific dates when we'll get it in July, and once we get it, of course, we'll be using it. So that would be for AstraZeneca vaccines, because we have been getting AstraZeneca through that source. In terms of the African Union, we have been working with them, and we have paid for the Johnson & Johnson vaccines, and we are currently now engaged with them to look at possible dates and so when those shipments would occur. But the ministry has been in contact with the suppliers in the African Union. We don't have a specific date as yet. You would also recall that we have paid for 100,000 doses of Sinopharm vaccines, and we are expecting those to come in by the end of this month. Those arrangements are currently being made for us to receive them by the end of this month, maybe early in July.
Okay, Minister. Thank you for that. Now, I have some questions from Newsroom. They said Dr. Carpin made a Facebook post indicating in recent weeks more Afro-Guyanese are dying from COVID-19 at the ICU. What is causing this? They're asking what is causing this.
Well, that's a good question. What we have seen in the last couple of months is that we have had an increase in cases of hospitalization. On average, over the last 2 to 3 months, we have seen, on average, maybe about 80 to 90 persons coming into the hospital. And a smaller percentage of those persons would end up in the ICU. So what we have seen is a more severe form of the disease requiring hospitalization and ICU care. And we have also seen over the last 3 months an increase in deaths. One of the analysis that was done, we didn't complete as yet all 400 and something deaths that have occurred. But we were able to do a preliminary analysis of about 202 of those deaths. And in that very preliminary analysis, one of the things that we have noticed is that for African Guyanese, the deaths have been at 36.6%, Amerindians at 28.2%, and East Indians at 23.3%, mixed races being at 11.4%. So, as I said, this is an incomplete study, but if this trend holds true, then it's something that we'll have to investigate further. What we know is that from the ICU, most, if not all of these patients were not vaccinated. And so what we're urging people to do is to make sure that they get their vaccines, get both doses of the vaccines, so as to prevent admission into the hospital and admission into the ICU. Many of these patients, when we review the comorbidities, the things that, the underlying diseases that they've had, we have noticed that people with high blood pressure represented 31.7% of these patients. People with diabetes, 28.2%. Those with chronic kidney diseases, we have seen those patients dying at 6.9% of them. And 4.5% of these patients had cardiovascular diseases. Those with ischemic heart disease was 3.5%, and those with immunodeficiency, they represented 2%. So there are various comorbidities that we have seen with these types of patients.
Okay, Minister, thank you so much for that, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, and our social media platforms.